بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد صلى الله عليه وسلم. I would like to welcome all of you to tonight's webinar titled Capacity Building and Sustainability in Healthcare, which is organized by the Medina Institute for Leadership and Entrepreneurship in collaboration with both Digitum and Tip.com. MILE, Medina Institute for Leadership and Entrepreneurship, is a non-profit leadership development academy located in Al-Medina Al-Munawwara. Digitum is an IT company in Saudi Arabia, which is specialized in developing many solutions, majority of them in the healthcare sectors. Tip.com is a virtual clinic based in Egypt, and it is a new innovation in how the medical doctors can interact and deal with their clients. And my name is Muhammad Mustafa Mahmoud. They call me for short Dr. 3M, and I am the CEO of Medina Institute for Leadership and Entrepreneurship. I just wanted to hear, if you can write on the chat, if you can hear my voice clearly. Oh, thank you. So this is, I'm glad you can hear, and many people are confirming that they can hear my voice. Tonight's presentation will be made by Dr. Mariam Hussein, all the way in Toledo, Ohio, maybe 7 or 8 or 9, maybe time difference, we'll find out very soon. Let me just in the beginning, after welcoming you, just tell you that this is number 7. If you look at this table, we have today is the 7th webinar. We have been doing this every single week almost. I think we skipped only 1 week, where every week in the same time we have a webinar in the area of e-health and the related areas. And these are the speakers. You can watch all the past video recording in our YouTube channel. And upcoming in the future, in February and March, we'll still have lots of webinars to come. So far, this is some of the key statistics of the participants who participated so far. We have 3,000 in the past 6 webinars. We have 3,000 registration, 1,700 participants from 45 countries. Saudi Arabia is the majority, and we hope in the future we will get more participants from other countries. MILE organized several leadership development programs, which are very intensive. They are our flagship programs. We have one for private sector leaders, another one for government leaders, and we have this one, which is called HPHO, High Performance Healthcare Organization. This is dedicated for healthcare leaders. We have offered this several times in the past, and our upcoming edition will be in March, just before Ramadan. So people who would like to spend the few days of Sha'ban in Medina al-Munawwara, they are welcome to join us. So far, we had 207 leaders, healthcare leaders, who participated in our past healthcare leadership program. These are samples of the logos of the organizations which have been working with us in delivering and organizing these programs. So our speakers and our sponsors come from this organization. This is a sample of the speakers who contributed to our past sessions in the HPHO, High Performance Health Organization. And this is the date. So we look forward for those who are interested to participate with us in our upcoming edition, the 5th edition. They are welcome to connect with us. The program will be during the week 19 to 24th of March, and it will be about innovative, practical, and sustainable transformation for healthcare organizations in Al-Medina Al-Munawwara. It will take place in Al-Medina Al-Munawwara. These are the speakers who will be participating in this program. They are coming almost from Saudi Arabia, from London, from Cairo, from America, from America again. So this will be all the speakers. The sixth day, the last day, because there are 5 training days up to Wednesday. But on Thursday, we will organize a conference. So the last day is a conference. We don't have 1 speaker per day, but we have many speakers. And I hope you can make it to this event, inshallah. Our tonight speaker is Dr. Mariam Hussein. We'd like to thank her very much for accepting our invitation. She's the president of the Islamic Medical Association of North America. She's Dr. Mariam. She's an MD, and she has MPH in hematology and oncology, fellow at the Ohio State University James Comprehensive Cancer Center. She graduated from the Ohio State University College of Medicine and completed the residency in internal medicine. She is the current president of the national nonprofit IMANA, Islamic Medical Association of North America. And she has been working in public health education and creating domestic campaigns for food insecurity, reproductive health, mental health, and climate change. IMANA is a leading resource and the network for American Muslim physicians, dentists, and other healthcare professionals in North America. Faith is a driving force in her life. I like this statement, and we wish her all the best, and Allah subhanahu wa ta'ala use her, inshallah, for the benefits of the humanity and this ummah. And she has seen a profound impact of integrating science and faith in her own life. Without further ado, I would like to leave the floor to her. Please try to turn off any other application that you might have in your computer so it does not slow down the connections. If you lose track or get disconnected for any reasons, you can carry on watching us live on YouTube. And my colleague Faisal will post in the chat the YouTube link, which you also can share it with your colleagues so they can just walk in and watch us in YouTube, and they don't need to sign in. If you have any questions, put them in the chat, but direct them to the administrators, to the moderators. Don't direct them to everybody. So Dr. Mariam, whenever she feels comfortable, she will inshallah check the questions and try inshallah to answer your question. Dr. Mariam, it's 9:09. I have taken 9 minutes from your time. The floor is yours, and please, you can take control of the share from your side.
Inshallah. No, thank you so much, Dr. Mahmoud. I really appreciate that introduction. And it's great to learn more about MILE. I think what you all are doing, mashallah, is incredible. So thank you for the invitation. I can share, I think someone has to stop their screen sharing, if that's okay. And then inshallah, I can. Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Again, thank you so much to Mile, to Dr. Mahmoud, to Brother Zafar for the very kind invitation. It's really my pleasure to be here, and Juma Mubarak to everybody. Happy Friday. Can you see my slides okay?
Yes, we can see you and the slides both, and we can hear you as well.
Okay, great. Thank you. Okay, so as Dr. Mahmoud mentioned, it might be easier to take some questions at the end. And so inshallah, I'll get to the slides. I'll also say too that this is a very in-depth topic. And so definitely each thing that I bring up could have its own hour-long presentation about it. So inshallah, we'll get to this a little quickly, but I'm really looking forward to the conversation and the questions that you all may have. So to start off, I have no financial disclosures. And these are some objectives I was hoping, inshallah, we can get out of this talk. Just understanding what healthcare systems look like, what they are, how they interact or intersect with social determinants of health, discussing capacity building, which is why we're here. And then also capacity building and medical relief work, which is what we do here at Imana. And then also relating it to sustainability in healthcare as well. So to start off, just to put a little bit of perspective for where I'm coming from. So in the States, I went back to do training in hematology and oncology at the Ohio State University here at the James. And I went back after being a hospital doctor for 4 years. And then, so inshallah, I will actually be starting here at the James as a faculty member, as an oncologist in the fall as well. And then the other hat I wear too is, as Dr. Mahmoud mentioned, as the president of Imana. And so we're a 54-year-old organization that focuses directly on medical relief work. So how do you actually build capacity for physicians and healthcare professionals to respond to disaster situations? And we collaborate with partners anywhere from the WHO, the UN, to US agencies as well. So, but before healthcare became my path, I actually wanted to be an astronomer. I was obsessed with it. And when you learn more about the Earth, and it makes you really think about our current model of thinking and where we came from, and why do we think the way that we do, and what systems are in place that make us think that. So what do we currently believe and why, right? We know now that our world is a sphere, right? And it orbits a sun in the distant reaches of a spiral galaxy, and which is one of many galaxies in a very, very wide universe. But it really wasn't until about the 1600s. So in modern, and this is by Julian calendar dates, not by Islamic calendar dates, but in the 1600s, that's when the entire global community, most of them at least, came to a consensus that, hey, the Earth is not the center of the universe. And it wasn't until the 1920s, so only about 100 years ago, that the Hubble telescope was launched, and we were able to actually see not just what we read in the Quran, but what we could see how vast the universe actually is, and how much of it we didn't know, and how many more mysteries there are. So science, mashallah, is great, but it evolves over time, and it evolves based on our understanding. And when we look back, we can see how much we didn't know, and what we used to think was right turns out to be something different. And then it makes me think of this, one of my favorite books by Dr. Marcelo Gleiser. He is a Brazilian physicist and an astronomer, and he's currently the professor of physics and astronomy at Dartmouth in the States. He's actually the winner of the Templeton Prize too, and he writes in his book, how we try to make sense of the world and of our place in it, it should be obvious that our approach is fundamentally limited in scope. This realization should open doors, not close them, since it makes the search for knowledge an open-ended pursuit, an endless romance with the unknown. That actually reminds me, I believe that this pursuit reminds me of what is very consistent with faith. So from chapter 29, verses 19 to 20 in the Quran, again, I'm not Arabic, but at least for the English speaking, that, say, travel through the earth and deeply observe how God did originate the creation. And so in my mind, what is observation if not science, right? And so I do think that faith and science are not opposites at all, or that are in conflict, but actually they're interrelated partners. And their synergy together can help us observe and understand things more than we could ever imagine, and help us understand too more about the earth and our place in it, and the systems that are so essential to it, and to understanding how we function and how the world around us functions. So what is the earth if it's not a system, right? And so it's a completely self-sustaining model of functioning that has survived independently for millions of years. Right? How many, generations of animal life and different species and biodiversity that's been here, that just exists, and it's able to work with all these different inputs that come into it, from either from outside of the earth itself, from the sunlight, or from the soil itself, for example. And it efficiently creates a lot of outputs, such as food, energy, as well, with little to no waste at all. And what we may see as waste is actually ultimately recycled to then become another input. So if the earth's goal is to sustain life, it's done an amazing job, mashallah, right? But then when you look at healthcare, Healthcare as a system is also, if you think about it, that it has a lot of inputs, a lot of outputs as well, right? I may try to diagnose a patient, and the output is that hopefully they're able to get some benefit from a medication, let's say, for example. But the reasons for organizations like MILE and HPHO is that they're created because maybe the healthcare system doesn't function at its best, maybe. And it's difficult to talk about capacity building if we don't appreciate the full system that is health and healthcare, and to understand what is the actual goal of the healthcare system. So although the most visible aspect of healthcare may be, the individual patient visit or surgery, it isn't just about that. You end up seeing that health is actually part of its own entire system too, where there are several inputs that contribute to someone's individual health. So I may have a medication, but if I have socioeconomic problems and social issues, that will adversely impact my health. Or if I live near a power plant or where a farm where there's a lot of pesticides, that will also directly impact my health as well too. So it's not just one input, but multiple inputs that impact people's health in general. And this is consistent with the World Health Organization's definition of health that they put out years ago, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so we see that as well with this social ecological model of healthcare that's been described by the CDC, which is the Centers for Disease Control and Prevention here in the States. And so we're reminded again that healthcare is also part of an integrated system that relies on many factors such as interpersonal, organizational, community, and national inputs as well too, basically to optimize people's health, not also on an individual level, but also on a population level. So it's not enough to give a medication, but you need to know what are the public policies in place, what are the patient's individual social issues, et cetera. Back in 2012, the Harvard Business Review actually posted an article where they discussed how vital social determinants of health are as a major contributor to health. So for the healthcare system to work, do we actually ensure that all of these factors are adequately addressed as they should be? And a lot of people would say no, that the arguments are out. Actually, healthcare system itself is broken. And so this is actually from another article from Harvard Medical School where they talk about some of the main reasons why healthcare is broken. And the top three that they've listed is that the cost is too high. And so even with that increased cost, you have poor health outcomes. So you're paying more, but you're not getting the outputs that you want. Access to healthcare is not equitable, that some people get it, some people don't. And there are many different categories of people who do have access and don't. And then investments in healthcare seem to be misdirected, is a quote from them as well too, that perhaps the emphasis ends up being more on expensive technologies or on particular specialty care, but then the focus on preventative healthcare or making sure that everybody has access to healthcare. Or even the fact that some healthcare is just very fragmented. That's in some scenarios you'll get some care, but in other scenarios you won't. These were some of the factors that they think are contributing to why, specifically in the US as well, that why the healthcare system may be broken. But for those in other countries, you can see how there might be some similarities in your countries as well. So just to confirm the point that I mentioned before about the cost, that in the United States, and this is was some of the top 10 ranked countries in the world, that according to, so this was from a Commonwealth Fund study that was done in 2015, that by and large, the United States spends the most on healthcare out of any country, yet we have worse outcomes compared to these other developed nations. And what they think could be is that the reason why we spend so much on healthcare is because a lot of use of medical technology that has a lot of higher prices, but then again, we don't see as much of the output that we would like to see. Another issue that also affects the healthcare system is structural disparities. So this is, a kind of a funny meme here, just talking about, just showing what exactly structural oppression looks like. So it's not just about race, but it's also about gender. It can be about class as well too. Where did you grow up? What sort of profession do you have? And even just access to healthcare in general. Do you have insurance or not? That's even a big issue in a lot of healthcare systems as well. And one part that for me specifically as someone in oncology, I felt like this quote really drove home the point of what is wrong, the direct point of what is wrong with healthcare systems, with systems at times. And Robert Proctor is an American historian, and he's actually a professor at Stanford University as well too, of history of science. And he currently works at Pennsylvania State University. And in his book back in 1995, he talked about cancer in this book called Cancer Wars. And what he says is cancer is caused by chemicals in the air we breathe, the water we drink, the food we eat. Cancer is caused by bad habits, bad working conditions, bad government, and bad luck, including luck of your genetic draw and the culture into which you were born. So just like we talked about before, there are so many different inputs that can contribute to someone's health. And it's not just one thing, but we have to be direct about what those problems are. And then the most recent example that I don't need to tell everybody in this audience as well too are the deficiencies in our local and global healthcare systems that were immediately thrown into light by the COVID-19 pandemic. We see here in the States specifically, we saw all the underlying structural inequities that exist that lead to poor access for people based on class and race. It also laid bare the inefficiencies within the supply chain. And I know that's something that everyone around the world has felt as well too. But it also made us realize that no matter how much technology we have, no matter how much we spend on it, you could have the best groundbreaking vaccines, which we, alhamdulillah, were able to have. But if the consumer of this system, your patient, does not use your services, such as refusing vaccines, your system has not achieved its goal ultimately. So this leads us to capacity building. And when you think about capacity building, there are many, many examples of what it can look like. And there are different images of what, different recommendations people have on what is the best way to build capacity. And basically what we see in an official definition of capacity building, to put it all into perspective, is a process that improves the ability of a person, group, organization, or system to meet its objectives or to perform better. And one further point is to perform better for what purpose? What is the goal of healthcare or of your healthcare system? Is it health? Is it profit? Is it both? And if it is both, when do you prioritize one over the other, or should you at that point? So when it comes to healthcare specifically as well too, again, there are many different models of what you can do and how best to build capacity. And I think the main point of this slide as well too, and with the others that I showed, is that the point with these strategies is that one size does not fit all. That you may have the best plan and it may work the best for one population, but it will not work in every industry, in every region, or even every healthcare organization. And the best way, and that's even more true when you discuss healthcare in different regions, like I just mentioned, around the world. So what works, let's say in the United States for myself, and even in Ohio, not even in a different state, would be completely different than what would work, let's say in the Kingdom of Saudi Arabia, for example. And imagine, how much more of a difference that would be in countries that are developed versus undeveloped, ones that are war-torn, and those who are being devastated by climate change. Those systems and those contexts are going to be completely different case by case. So let's look at some examples. So when you look to West Africa here, and the CDC actually described in 2017, after the Ebola pandemic was raging in 2014 over there, that they discussed the capacity building efforts during and after the Ebola epidemic in Liberia, Sierra Leone, and Guinea. And it led to significant public health progress in 4 key areas: emergency response, laboratory capacity, surveillance, and workforce development. That was something that this area specifically needed, that specifically pertained to a crisis of that region. Now let's look at another example with Japan. So Japan had created the Japanese Disaster Medical Assistance Team, or DMAT, in response to all the earthquakes and tsunamis that they would face because they're around that ring of fire in the Pacific Ocean. So this also included the Japanese DMAT Investigative Commission and the Ministry of Health, Labor, and Welfare. And they worked together back in 2014 to update this team's plan, essentially after the Great East Japan earthquake of 2011 that we had all heard about the devastation from that earthquake and tsunami. So that specific area didn't necessarily need to worry about viruses or epidemics at that time, but their main concern was about how do you improve the structural integrity of your buildings and how do you keep people safe during an earthquake. So again, responses are very region specific, but even though there are those differences, there are some principles that you could to improve capacities in ways that are evidence-based and also holistic, in the sense that you look at the organization, not just the individual parts, and realize that your system is a whole and interrelated. So I like this graphic. I felt like this was the most visually easy one to understand, that some of the main aspects of capacity building that are a helpful place to start the conversation. So some of the aspects are organization development. So how do you develop your individual organization, developing partnerships, developing leaders, competent leaders, the ways that we take action as an organization and which ones do you want to take as an organization, the process of reflecting, monitoring, and evaluating what you're doing to see, is it even helpful or not? Are you achieving that goal that you're setting out? And then ultimately sustainability, and not so much from an environmental perspective, but how do you make sure that everything you're doing, you can continue to do going on to the future. And these are not always in a cycle where one leads to the next, but they're integrated and interdependent as well. Another tried and true solution to this capacity building issues as well is a better known method is called Six Sigma. And so this was a set of techniques and tools that are basically used for process improvement. And it could be any process that you are working with in any industry. And it's essentially a set of principles, not actual procedures, which is why this technique has been so successful. And you see a lot of companies, even hospital systems like Harvard and Stanford, use this method to improve system processes in the hospital, for example. And this was created by an engineer back in 1986. So I definitely recommend people to look at that as well. So why would someone like me care about capacity building, right? And so our goal at Imana, like I mentioned, right, is to provide direct medical relief. But everything that we do tries to center around the practice of our goal, which is specifically medical relief by building capacity of healthcare professionals and physicians. So this is our slide that highlights all the missions that we've done around the world since we started our work in 2003. And basically what you can see is that in the last 2 decades almost, is that the amount of trips and missions that we've had to go on has significantly increased over the past 20 years. And this is not a unique phenomenon to Imana, but this is to all organizations working on relief work. And these situations that we respond to are typically from climate change induced disasters or any other crises that ministries of health or NGOs ask us to respond to. And we tailor our efforts in the same way to each specific region and country. So that's how we build our capacity. So for example, on the left-hand side, those 2 pictures at the top, there's a great need to correct cleft palates in Sudan. So that is their main need that we had witnessed. So therefore, we focus our surgeries and our supplies related to this particular issue. On the right-hand side in Syria, for example, in the camps near the border with Syria, that primary care is a major need, and chronic disease management, because a lot of patients don't have access to their medications because of the war. So we focus on providing medications and internal medicine needs, and then we know which physicians we need to prioritize. At the bottom for Haiti, in addition to medical needs as well, clean water access was a particular issue that the local community there told us about. And so what we then started focusing on an actual water project where we built 2 wells near the clinic that we work at to help patients, especially young girls, not have to travel far to get water so that they can go to school. So this is Hurricane Maria when it hit the islands of Dominica and Puerto Rico in 2017. This was one of the most devastating hurricanes we had in our region. And the reason why it was so important is because within a 15-hour period, it had transformed rapidly from a Category 1 hurricane, which was the least amount or least intense hurricane, to a Category 5, which is the most intense we have recorded. Again, within a 15-hour period, that shocked forecasters. They couldn't believe it had it had rapidly intensified that quickly. So we responded to this crisis as well too, and provided medical care to patients longer than any other NGOs had, mainly because what we were told in that region was that we need a longer period of transition before we can take over these services. So can you stay longer? So again, responding to what the specific region needed, and then we adjusted our capacity for that. And then we also realized much of our work that we do is about climate change adaptation, which is essentially the concept of adapting to climate, to changing needs as a result of crisis situations created by climate change. And so I think to truly understand this relationship between healthcare and climate, I think we have to look at climate change from a systems level and realizing how sustainability focus is actually a practical solution to capacity building issues that may result. And this is not meant to be a political conversation, but just focusing on facts. So this is a description of the world map of kilowatt hours per capita of energy consumption in 2020. And you can see that there's a difference. So the countries that have more red use more electricity and more energy, and those that are more purple use less energy. And there's almost kind of a line that you can tell here that there's this divide, which represents essentially the global north and south divide that we hear about. When you look at the impacts of climate change in relationship to that, which is measured by the Climate Demography Vulnerability Index, the CDVI below, and again, that shows that the ones that are in red are more vulnerable to climate change impacts, and those that are blue are less vulnerable. And you can see that there are these disproportionate impacts again between the global north and south. That those in the global south have been facing hurricanes, cyclones, wildfires, drought, and of course, human conflict and war. And there are projected to be a disproportionate, a large percentage of climate refugees coming from these countries to the global north. That you see here. And so these disproportionate impacts directly impact human health, not let alone animal and plant health, but directly human health. So again, the CDC, our prevention organization in the States, they've outlined all the effects of climate change on health. And you can see again, how interrelated they are and how almost systemic they are too. That one is not independent of the other, but then they're all related to rising temperatures and more extreme weathers. So it goes without saying that this is inevitably going to impact capacity building, right? And for any healthcare system to respond adequately to healthcare needs. Because when you have one problem that's leading to 10 others, how can you be prepared and adequately respond to these needs? So what can healthcare do about this, essentially, right? So not only is healthcare, the reason why healthcare is such an important factor into this conversation about sustainability and capacity building is because not only is healthcare being affected by these external factors like climate change, but it's ironically a big contributor to greenhouse gas emissions. So Practice Green Health is one of the eminent organizations in the States that is focused on what healthcare systems can do in relationship to sustainability. And nationwide, certain results have shown that healthcare represents about 18% of the US economy and about 10% of the global economy. So everything that healthcare does by leaving the lights on, which they have to, by all the procedures that we have to do and technology that's used as well in order to provide care, a lot of that leads to greenhouse gas emissions. And so, for example, that inpatient care in the States is rated as the second largest use of energy in the States. So inpatient healthcare, when you're in a hospital, that's the second largest consumer of energy. Healthcare facilities consume close to 10% of the total energy used in commercial buildings, and they spend more than $8 billion on energy every year. That's just healthcare facilities and their buildings. And the healthcare sector is reported to be responsible for about 8.5% of the US's annual greenhouse gas emissions. So a lot that healthcare needs to do and what it's being affected by as well. And so there are solutions to this. And there are, for example, these roadmaps that organizations like Practice Green Health have developed to essentially decarbonize our healthcare systems. And not just from one angle, but all angles, looking at it from a holistic standpoint. And basically, this is a very busy slide, but it shows all the different access points that healthcare can influence and change in order to decrease its carbon footprint on the environment. And it might be a little hard to see, but for example, buildings, right? And how the energy use of each building, the chemicals that we use, that a lot of these chemicals can leach out into water systems and then end up hurting other non-human life as well. So how can we reduce the impacts of that? Energy use, of course, that goes without saying. Food, for example, food is a huge contributor to greenhouse gas emissions globally. And so if we were able to focus more on local foods, could we improve access as well too? Surgical services, the operating room uses a significant amount of energy as well too, and anesthesia gases also contribute to global warming effects. So there are many different areas, even just in the operating room, that can be tapped into to decrease these greenhouse gas emissions. Sustainable procurement, I just want to highlight this as well too, that where you actually buy your materials from and what materials you buy, if there is a conscious focus on that, on where you're obtaining these, that can also decrease healthcare's impact on the global systems as well too, and decreasing emissions. Transportation goes without saying as well too, and then also decreasing waste, not only trying to deal with waste better, but how can you decrease waste as well? So again, as climate change is going to increase, as you can see, that this is just going to, our job is already hard enough as it is, and it's just going to make the job even harder too. So it's better to stay on track, to recognize these issues earlier so that we can stop what we're doing now and shift potentially in order to decrease some of these impacts. And basically this here just shows that if we do business as usual in the States, which is kind of the orange area right here, where the projected amount of greenhouse gas emissions are expected to be, versus if we actually do some of these decarbonization procedures, where we can be here in the green, and where it's expected to essentially be somewhat stable, if not less, from where we were before. So again, just some ideas, for thinking about in your particular sectors as well too. Basically, one thing that these organizations recommended is that these systems make a commitment. First of all, just even to acknowledge that this is happening and to make a commitment that we are going to do things, what we can, to decrease our impact on healthcare's impact on the environment as well too, in order to ultimately improve their own capacity building. Trying to focus more on zero emissions and promoting essentially action on the part of healthcare systems and healthcare professionals to try to decrease the impacts of climate change on healthcare and people's health as well. So ultimately, why does this matter? Why did this kind of get shifted, and why does sustainability matter so much, not just to health, but to systems and to capacity building? Is because if we don't change what we're doing right now, no matter what technology we have, no matter what genius leaders we may have, the environment will not be sustainable enough above 2 or 3 degrees Celsius for us to be able to respond adequately to what the environment is going to do to us. And if we can stop early enough, this blue shaded area basically tells us that we'll be at least in this 2 to 2.5 range degree of Celsius. That is consistent with human life, the way that we know it today. Anything above that, typically above 3, if not 2.5, is not going to be consistent with the life that we know it as well. And any chances of capacity building are going to be extremely minimal and extremely difficult to even achieve. The WHO back in 2020, along with the World Economic Forum, laid out about the 10 biggest threats to the entire global community over the next decade. So we're just 2 years into that decade right now. And you can see here that the climate debate, bringing health and healthcare systems into this climate situation, or not elevating, I should say, into it, was going to be one of the biggest threats if we don't bring health into the climate debate. One of the other threats too is that if we're not able to deliver health because of continuous human conflict and crises like climate change. Those two areas right here are directly related to healthcare systems and capacity building. And so even more reason why we need to keep those two together when we're thinking about moving forward, when you think of your own system, and keeping in mind that sustainability goes hand in hand with capacity building as well. So I mentioned Practice Green Health a lot here, at least in the States. Like I said, that's the main organization we have here. But internationally, there's an organization called Global Green and Healthy Hospitals. And I'd really encourage everybody to go to the site and to join and make sure your healthcare system joins in as well too. This community has over 1,500 members in 75 different countries, and they all represent the interests of more than 60,000 hospitals and healthcare centers. And so there are actually, I just checked this morning, and there are a few hospitals even in the Kingdom of Saudi Arabia that are a part of this network. So there definitely more need to join, and then more to be involved and to be updated as to what you can do specifically in your own region on how to improve capacity building in response to all of these threats that we're going through. So to bring it back all together and bringing again sustainability into the focus as well too, that again, we cannot just think that that we can technology our way out of these problems. That is one aspect of healthcare and addressing healthcare needs, but we have to look at healthcare as a system, as a whole, in order to make sure that we are adequately responding to the needs of the community itself in this particular area, and then making sure our own actions aren't making a situation worse. And so here were just some ideas based on the global health threats that the WHO and World Economic Forum mentioned, and where they can intersect in different parts of this capacity building focus as well. So again, I know there's a lot to discuss, and I want to make sure there's enough time for a Q&A as well. And so I'm looking forward to the discussion as well too. And one thing to leave you all with, so this picture is one of the farthest views that the Hubble telescope was able to get in the last few years. And no astronomer had ever imagined that we would be able to see as far as we have to that point at least. And just last December 25th of just 2021, the James Webb Space Telescope was launched, where it is expected that we'll be able to see even billions of light years back into the universe, more images than even what Hubble was able to tell us of what the early universe was like, and where we came from and all of that. And so this actually just gives me a lot of comfort, because even though the world is not perfect and our systems are not perfect, there's still so much for us to learn and understand and opportunities to change. And we still can do that right now by investing in these sustainability and capacity building focuses. And it just, I think, ultimately comes down to what our goals are, right? And remembering what the Quran tells us as well too. So thank you all again for your attention, and thank you again for the kind invitation on behalf of Imana, and I just really appreciate it and looking forward to this discussion. I'll hand it back over to you, Dr.
Okay. You can check the question and answer box.
Sorry, I was on mute. Yeah, so thank you. Someone had to answer a question that, from your point of view, why are there people have so much fear of health systems in Europe and the USA? Oh, yeah, so I think why they're fear of health. That's a really great question. I think it comes down to what I had mentioned before as well, that you can have the best systems and the best healthcare, but if you're not reaching out to who your consumers are, it can be very difficult to get people to want to get healthcare from you. And I think specifically in the States, where it relates to us, is that for communities of color and for people who are disadvantaged, there were a lot of bad practices that had happened and a lot of injustice that had happened where either healthcare systems were not honest with people or they did experiments on them against their will. And that led to a lot of mistrust. And so I think what you're seeing, and again, what the COVID-19 pandemic has done is that really shown how we need to focus on getting the public back into these healthcare conversations and helping to build that trust again. I think that unfortunately that is something that's going to take some time, and but however, that's a capacity building focus, right? That not only do you improve your healthcare, but how do you improve communication and bringing people who are outside of, your typical audience? How do you bring them into the conversation and help promote public health education and prevention and focusing on education, right? Not just high income jobs, but how can we get our communities educated once again too. So I hope that helps answer your question a little bit.
If you may, Dr. Mariam, I was very glad to hear about the healthcare facility carbon footprint. And I'm just wondering, with the COVID-19 and the shift toward the virtual healthcare delivery and virtual clinic, don't you think that this moving into digitization and delivering healthcare will reduce the number of people walking into the facility and reduce the economical impact, the environmental deficiencies which you just mentioned?
Yeah, that's a great point, Dr. Mahmood. Yeah, absolutely. So that is definitely a part of, and I apologize if I didn't mention that earlier, but yeah, that's definitely a part of a capacity building focus that a lot of healthcare industries are and consulting agencies are telling people about, that so that will definitely help with decreasing the spread of infectious disease and viral illnesses. One thing though, just to think about it, is that making sure that, so not even the environmental impact, but to digitize, it's predicated on an internet system. And so even in the states and cities, we have great internet, but the minute you go outside of the city to rural areas, there is a very decreased amount of people who have access to internet. So then you rely either on the phone or suboptimal technologies, such even just talking on the phone instead of looking at someone to say, how are you feeling, and to do an exam. So ensuring, so when you look at digitization, again, not just looking at the individual, but as the system as a whole, how do you improve broadband access and internet access for people? And then the other thing is that it's a great point that I'm glad you brought up, that it takes a lot of energy to use the internet and to use technology. Right. And so if you are using the same fossil fuel based energies, you can digitize and everything, and that's great, but you do nothing to contribute to decreasing greenhouse gas emissions. But if your energy sources are based on, let's say, wind or solar, I don't always like to say natural gas because that also has a lot of other impacts on people's health that isn't always necessarily climate related. But wind and solar, for example, or even algae-based. I've heard that some companies are even trying to work on algae-based sources of energy that you could then use as much time on the internet as you want, and with patient care, and you're decreasing your emissions at the same time.
Right, but
I hope that answers your question.
I understand that this webinar, for example, I don't think it consumed energy as much as if we have done it physically and we have to travel into a facility which is air conditioned and consuming gas going back and forth. In UK, all government agencies are required to include in their annual report a section about their ecosystem footprint. So I was reading the other day the Ministry of Education report in UK, and it lists how much saving they have done through virtual meetings and how many trips, because in the tickets now, when you buy airline ticket, it says how many carbons you will be contributing, emission you will be contributing. So they add up all the savings from all of these trips, and they have used virtual meetings in lieu of physical travel, and they transfer this into a numerical dollar value of saving of or tons of carbon emission that they have saved by having virtual meetings. I'm just wanted to.
No,
Okay.
you're so right. You're absolutely
There's another
right.
question by Mr. Iyad Abdul Haq.
Yeah, jazakallah for that. So in your opinion, how can we make people in Middle East and other areas in the world to classify public health and climate change as one of their most important priorities? Thank you so much for this question. I certainly don't want to be the Western person here to tell everyone here what they're supposed to do and what their priorities should be. However, I agree from a medical perspective and a healthcare perspective that if we don't address climate change, we will never be able to fully address public health or improve health for anyone, because eventually it will catch up and it will affect all of us. So I think the only thing I can say, and this goes back to what you had mentioned earlier, Dr. Mahmoud, about faith, that I think if money won't do it, because markets are changing to actually be more supportive of wind and solar as sources of energy versus fossil fuel based, if money won't do it, then I'd say to look back to the faith. Because mashallah, people here, especially in the States, we look to the Middle East and our brothers and sisters there as, as home, right? And also people who are more connected to the faith than us, even because you're closer to the, the two holiest sites in Islam, right? And especially people in this area. So we feel like, the leadership, we would love the leadership to come from there, from these Muslim majority countries as well, because of that faith, right? Because I think a lot of this is that our faith tells us that we need to focus on this, right? We're Khalifa of God on earth, right? And what are we doing to it? We're supposed to walk gently, yet we build everything everywhere and we leave waste everywhere, right? Corruption has spread throughout the land in Surah Rum, right? We are doing that. We're hurting all these different species, biodiversity, creation that Allah has created, right? We are directly causing extinction of thousands of species just because of all the fossil fuel emissions that we have, the foods that we eat, and that how we deforest a lot of land because of that, and just how we're expanding more and more, right? And so I think that if, again, I'm not a scholar or anything, but I think that as someone who is a science-based person, science is not the only way that it can get us out of this. I would say, please consider going back to the faith to try to make that part of priority. And also looking that economy is going to eventually switch to wind and solar. And it just makes sense to stay on top of that. A lot of these Middle East countries have solar, I mean, desert lands, right? Not all of it, but some of it desert lands, and with the wind, you could transform how we do wind and solar energy just by using the land that Allah has given us. So I hope that answers your question.
It not only answered, but touches our heart so much. I'm very glad to hear this. If you don't mind, there is another question by Amin Bawazir.
Oh, yes, they're there. Okay. So do you think that community engagement is an important component for capacity building in any community by offering a good knowledge and drive them to good and best practices for preventing diseases and promoting their health? I think you said that perfectly. I completely agree with you. And I think that that's what community engagement is. Again, if you have we have an amazing vaccine, right? Mashallah, a lot of these scientists for COVID-19, they created this amazing vaccine, and still half of the US population doesn't want to take it. And so if we don't, I think that is another priority, absolutely, for community engagement. And then also, again, educating people, right? People used to come to the Prophet Muhammad, peace be upon him, to ask him anything about health, about, patients, wealth, everything. They would ask him, and he would engage with them and give them answers, right? Whether they were poor, whether they were rich, whatever, he entertained everybody. And so I think that is part and parcel of our religion and our practices as well. And it, mashallah, has so many benefits of, again, preventing disease and promoting health, like you said. And I think I may have missed the other question as well, too, from Brother Ayad. So from your point of view, do you think the high percentage of health spending to GDP in the US is reflected on people's health in the country, or just it is related to type of capitalism in the country to increase profit without improvement on public health? I'm from the States, so I can talk about the States that yes, I think that, I think that it's both, to be totally honest with you. I think that people really do think that technology is going to help us more than what we used to do before. And I don't think that that's wrong. I think that I use CAT scans all the time to diagnose cancers, right? And we use biopsies and all of those technologies to figure out cancers. So 100% spending makes sense if it makes sense, right? If you're actually doing something to help people. But I think the problem is that, again, people are looking at it from just one point of view instead of as a system. That if you use a lot of money, but you don't have community engagement, like Aman said, and if you don't educate people and you don't have ideas for how can you decrease your greenhouse gas emissions, then you waste money because you're not getting the outcomes that you want. And unfortunately, capitalism can be very good. We've come up with a lot of good technologies because of it. And our idea of commerce and trade is not bad, right? Capitalism in and of itself is not bad. The problem is humans and what they do with the things that they create and with what Allah has provided them, right? Is what we do in our actions. And unfortunately, and that's what I mentioned earlier, that what is our goal? If our goal is healthcare, what we're doing makes no sense. And end of period sentence, right? What we're doing doesn't make sense because we're creating more climate change, we're spending more money, people are sicker. So maybe profit is the goal then, right? Short-term profit. And the Quran talks about that too, right? Short-term gains for long-term gains. But if your goal is health, or if your goal is for Allah, then we need to change what we're doing completely. And we need to focus back on people, community engagement, like Aman said, focus on what we're doing to other animal and plant life on this planet that are creations of God, just the same as we are, and bring it back to how do we truly focus on wellness? Like I mentioned before, all those aspects of health, and not just your blood pressure is good, so your health is good.
Great. Thank you so much for a very comprehensive answer. The last question is from Basma Zainul Abidin. What a beautiful name. Basma and Zainul Abidin. So if you just go ahead and read the question. Yes,
I will. Okay. So, wa alaikum salam. She had put in the chat. Okay. So the question is about healthcare focusing. How can we obtain the capacity of sustaining the organization of health workers, especially in this time of the pandemic, where we ourselves are affected with this disease? How can we help others to keep the will and intentions and going to healthcare facilities? Yeah, that's a great question. I'll try to answer it as quickly as I can. That I think that's part of, capacity building, right? Is that there are again, wherever hospital system you work at, you can have the best technology, but if you don't have workers there to take care of patients, it's essentially a useless facility, right? So I think going back to making sure that really focusing on healthcare workforce, that making sure the healthcare workers have N95s or KN95s, that they have masks. And if that costs money, you spend that money. Because if you don't have healthcare workers, you don't have any outcomes and outputs. Making sure that you focus even on the worker shortage in the sense of investing in medical schools and health professional schools, so that you have people who can then take over for those people who are either overwhelmed or want to retire, for example. These are not short-term answers, but again, looking at things as a system, that we can have short-term solutions, but they may not make sense in the long term. And then in terms of the will and intentions of, people going to the healthcare facilities, I think and again, just coming back down, the Prophet, peace be upon him, he would just tell people, right? You cannot make people do things, but you can tell them and spread a message. And so if we can do our job to just tell people what we know about health, from that it's a sunnah to know about your health, to take care of yourself, to not cause harm to others. If you save a life, it's as if you saved humanity. You kill a life, it's as if you killed all of humanity. So I think just reminding people again that faith and science connection, I'll leave with this. The faith and science connection is very important to me. And I think it'll save all of us. That if we just bring those two together, that they're not enemies, they're not in conflict, they work together, and reminding people that they have a duty not only to themselves, but to their God and to people, maybe we can change some things, inshallah.
Oh, great, thank you. We are running out of time. It's 10 o'clock. I will just have one final question, and it's, being the president of IMANA. Am I pronouncing it right, IMANA?
Yeah, perfectly.
Right. So the Islamic Medical Association of North America, what kind of collaboration or relation the North American Muslim doctors can have with with the doctors in our region as a president? Are there any channels for collaboration or knowledge exchange?
I would love that. Yes, short answer, yes. That we can, whether that's knowledge sharing between each other, right? Such as, let's say, grand rounds or even webinars like this where we can talk more personally. And then with relief work, we would love to do that. We currently in this region, we work in Sudan, like I mentioned, Yemen, Jordan, and Gaza as well. And so it would be amazing to work with different physicians. They're building local capacity, right? Talking about capacity building and building it there, doing whatever we can to help locally, and then being a resource as well too. I'm more than happy to talk about that.
Very good. Dr. Mariam Hussein, your presentation was very informative, very entertaining, very inspiring as well, and faith building, and reconnecting us with the whole universe and with the Creator, subhanahu wa ta'ala. We have been enlightened and touched with your presentation. Thank you very much for your time. And I would like to thank you on behalf of everybody. I am only 1 minute away from Qiba Masjid, 3 minutes away from Masjid al-Nabawi. So I pray to Allah subhanahu wa ta'ala to reward you all the best and use you and for his pleasure and accept all your good deeds. And our greetings and regards to all the Muslim medical community in the United States. And we hope, inshallah, that in the future we can do more collaboration, especially in delivering our leadership and the training program in Medina. I would like to apologize for many of the participants who frequently asking us about continuing medical education hours. All of these codes that you see people putting in the chat, it is their formal registration number with the Ministry of Health, and attending with this webinar can be a source of gaining credit for continuing education hours. But unfortunately, in MILE, in Medina Institute, being a non-health training providers, we could not secure, just certification. So we had about 200 people attending the session tonight. If anybody, have any idea how he can, extend, a hand of help to us by showing us how to complete the formalization and the requirements, we will be happy to fulfill these needs. Thank you again, Dr. Mariam Hussein, and we look forward, inshallah, to see you again. And we thank all the participants who spent 1 hour and 4 minutes watching and following us in this webinar, which reflect, high level of enthusiasm from your side. Thank you again. The webinar is video recorded in YouTube. You can watch it in YouTube. And I will ask the permission from Dr. Mariam if she can share the PowerPoint slides with us. So because most of the participants always ask about it, we will email it to all the people who have signed up for this session. Thank you again, and assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much. Yes, inshallah, definitely. I'll share the slides.
Assalamu alaikum.
Alaikum salam.